So, I chose a topic for my paramedic 2 class to be PTSD and EMS and how it affects all the workers in our medicine skills. Overall, PTSD is a common occurrence among the general population, but it's been found out that PTSD is actually more prevalent in first responders. Up to 30% of first responders here in America actually have PTSD, and compared to 20% of the American population. And that's a significant factor due to the fact that PTSD has many other side effects or other feelings of emotions that are connected to it, which can be anxiety, depression, sleep deprivation, and these things are all factors that can lead up to suicide. This is a very new topic that is being studied, and it doesn't have much research done into it so far. But at the current moment, there is actually a lot of research going into this field to try to help protect our coworkers as paramedics and firefighters. A most recent study is being done by the Institute of Australian Health, I believe, and it was trying to see the effects that has on paramedics over in its country and globally worldwide, and how PTSD actually affects the healthcare that is given through paramedics. Its main topic was pointing out, saying that this can cause irrationality or the fear of giving medications or the pause, hesitance whenever you are on the scene. Possibly you can have anger outbursts. It's not that you do not have a clear mindset of judgment to actually make proper calls for your patients. And it happens a lot at a higher rate. Even for Canada, they show it at 26% of their workers say they experience PTSD on a study. And this can fall into many problems. There needs to be a lot more research done for it. One of the bigger things to be talked about, though, is how there is actually a community and a discussion going on, showing how over time there's been a higher talk about how suicide is actually affecting first responders, and how there is the connection with PTSD along with all of it. And post-traumatic distress syndrome is a major factor in all of it. And it takes toll on a lot of these providers. And along with all this time, there is about 1/3 of paramedics over a 12-year study here in America said they've contemplated suicide. And that is a very major factor for our care and how we provide to other people. If our care is lacking for ourselves, it's going to be very hard to care for others alongside in this world. The field is very wide and open, and PTSD is believed to be a mixture of lifestyle events that are very traumatic, ones that are very occurring. You see events that are not normally seen by public here in the medical profession, and you're going to probably see them sometimes on a regular basis, which is not normal for anybody to take. And sometimes if the person doesn't have a proper support system, it will build on them, and it takes a toll on their mental health and physical health, which over time decreases their ability to perform properly as a paramedic. There's other factors into it. It can be from poor home health or prior traumatic experiences that are from a house abuse, anything like that. And these are triggers that will cause it to happen again. and creating worse for the individual. And this also leads along with burnout. Sometimes it's very hard to tell the difference between PTSD and burnout because the signs and symptoms are very similar. And this can cause is a major defining line between of when intervention should be put into place to help these individuals in the field. And when burnout happens, is there's a loss of interest in the field. You're no longer providing the same energy. It just doesn't feel as fun. You don't feel the drive to go to work anymore. But with PTSD, it can lead to further causes of having stress, anxiety, restlessness, bursts of anger, and possibly contemplating suicide. It's a very serious struggle, and it's hard to point out all the times. And sometimes people will not show this. And there's moments it will trigger, and they will pause, and it would be evident that they're having these sort of issues. And it's important that we try to treat these things because it's to preserve the health of our personnel, to help make sure that we are providing care for everybody and ourselves in the long run. It is a major factor that paramedics are cared for so that they can keep caring for others. The overall, between multiple studies, there's the BMC psychiatric, and it talks about safe work with Australia and how America has signed on to do a 5-year study over this, and I believe they're in year 3 right now to go over that study, and it'll be out in a few years. There's also a documentary coming out within this next year of PTSD and EMS on how it's actually been very poorly looked upon. It hasn't been until the past decade that this has been addressed. Before this, it was very much told that you need to suck it up, that you may even lose your job, or you're told to leave your job because this is not a part of who you can be as a worker. And as we've continued on, seeing that this is just a part of what happens to people, it has become recognized the fact that we need to treat it, even with medicine, to try to help one another. Instead of trying to push it back, saying it's nothing, trying to be a tough guy. By doing so, we are only losing other people, and that is at our fault. So, within the past decade, it has been a major leap forward of trying to understand and identify all of this and how it's being affected through police, firefighters, paramedics, and what can be done. A major thing that has been done is group studies, saying how whenever people feel like they're part of a group, it's a lot easier for them to be able to come out and talk about these traumatic incidents. They don't feel like it's all built up inside. They don't have a vent to go to. And a lot of it comes down to physical and mental health, taking care of yourself to take care of others. It does come at a higher rate, sadly, and there's no other way to say it. There does show to be a factor trending that as we've looked into this, more people are getting treated better, and we're getting better outcomes for paramedics and individuals to have them be longer lasting in the field and happier, healthier lives in the career field, which in turn helps us have good patient care, good patient contact, and overall better results and outcomes for our patients. And overall, that is our goal as medics, trying to work and better the lives of others. And I would say that will be the conclusion of my analysis paper and for Paramedic 2 and PTSD and the EMS field and how it affects all the paramedics. Thank you.